opportunity to share my views on yoga and meditation, a cardiac rehabilitation alternative, in front of this August gathering. So we have a young male, a high-risk male in the productive age group, and the glaring questions in front of him include three. Number one, what have I done wrong so as to have MI at this young age? What are the cost implications of my therapy if it is going to be lifelong? And what are the chances of recurrence and how can I curtail that? So can modified indigenous diet look into the answer of all the three questions? I beg to differ. Because the psychological impact of eating less and change of diet is very much high in Indians, because India is a yummy country and food is like religion. And it can be acceptable, yes, I agree, but then is it going to be sustainable in the long run is again an arguable point. So do we have any alternative strategies? Yes. So if we look into the scientific statement from American Association of Cardiovascular and Pulmonary Rehabilitation, these are the 5 key components: healthy eating, smoking cessation, medical adherence, stress management, and physical activity. And healthy eating is just one of the components. We have to look into the other 4 components as well. Looking at the phases of cardiac rehabilitation after the initial phase when the patient is discharged from the hospital, we have to look into the other phase 2, where risk modification has to be done, psychosocial counseling has to be done, and then patient has to be brought to such a level that he can independently continue with risk modification with only periodical evaluation by the treating physician. So if we look into the 3 main components which I'm talking about: exercise, training, lifestyle modification, and psychological intervention, yoga and meditation is one which can play a key role in all these 3 aspects, be it exercise, training, lifestyle modification, or stress management. So giving you an overview of yoga and meditation, the 3 components which are very well studied these days and implemented include asanas, that is posture, mindful breathing, that is pranayama, and meditation, that is dhyana. So I'll deal with all these 3 in my subsequent slides. The difference between yogic exercise and physical exercise is that yogic exercise avoids violent jerky movement. It is non-competitive, it is wholesome, and it is done with conscious breathing. Whereas physical exercise is violent, competitive, and it works on selected muscles, and it is not with breath consciousness. Coming to the second component, that is breathing, when we do normal respiration, the respiratory rate is 16 to 18 per minute, and only 25% of the alveoli is involved in the process of respiration. Whereas when we do the deep respiration, it is increased by 10 times. So there is better assimilation of oxygen, better transfer of oxygen to the cellular level, then release of carbon dioxide and release of toxins from the body. So by doing deep breathing, we are improving the oxygenation at the cellular level and release of the toxins from the body. This is point number 1. Number 2, usually the respiration is the only autonomic function which can be voluntarily controlled. So the main part of the brain which works on that is the limbic brain. When we do conscious breathing, the focus is shifted to the forebrain, which leads to improved concentration, improved memory, and development of higher skills. So all these things can also be improved, and better stress management can be done if we do pranayam properly. As we all know that cardiovascular health is related to stress, and diabetes, hypertension, and myocardial infarction is related to stress. So this thing, if controlled by meditation, we can get a longer and better impact in the patient. So when we do yoga, we shift our focus from illness to wellness, and there is a body, mind, spirit integration, balance of body, mind, and spirit. By doing integration of breathing and coordinating it with the movement, what happens is, and when there is a focus in the present moment, the body becomes still, mind becomes calm, the emotion is becoming stable, and then there is a holistic healing which takes place in the patient. The basic mechanism of yoga and meditation is it works on the vagal system, and slows down the sympathetic system. So by better stimulation of vagal system, there is a better heart rate control, increase in insulin sensitivity, increase in glucose tolerance, reduction of HPA axis stimulation, which leads to a reduction in atherosclerosis and CVD. And by doing mindful exercise, as the stress is controlled, there is a reduced intake of drug usage, which is a very important factor in this patient, where he has to continue the treatment lifelong. Stress and obesity are correlated because stress leads to activation of HPA axis, increase in secretion of cortisol, comfort food and binge eating, and increase intake of alcohol or alcohol addiction. And all these three factors lead to obesity. Whereas when yoga and meditation is done, it stimulates vagus and reduces emotional and external eating and leads to abstinence of alcohol, which leads to better control of obesity. So if we look into all the core components of cardiac rehabilitation, be it weight management, blood pressure, lipid control, diabetes control, yoga and meditation has a role to play in all these factors. So if we differentiate between routine cardiac rehabilitation and yoga, what we are doing just a slight shift. Where stress management is done by medication, here we are doing the breath control and meditation. Physical exercise, which is a competitive exercise, here we are doing the smooth muscle movement along with conscious breathing. Lifestyle modification, we are doing counseling and changing the diet and all those things here. Because the patient becomes calm, there is self-restraint and utilization of better healthy diet in his life. So whatever I'm talking, do we have any scientific evidence to support what I'm saying? Yes, this is the first scientific review which has been published in International Journal of Cardiopulmonary Rehabilitation. It has shown that yoga has a multi-organ role to play, be it autonomic nervous system, metabolic, anti-inflammatory role, immune system activation, as well as neuroendocrine system. This was an article which was published in International Journal of Yoga by Dr. Indranil Basure, and he highlighted that yoga has been categorically found to inhibit baneful effect of stress. As we know that stress is related to broken heart syndrome or stress-related cardiomyopathy, and it has been shown that yoga and exercise are some of the methods which can be implemented to control the stress, which has been brought out by Dr. Erin Mikos. This was another study which was a systematic review and meta-analysis which was published, which showed that it is a promising alternative for patient of CSD and it improves the quality of life. This was a landmark trial which was published by Dr. Durairaj Prabhakaran, which is a yoga care trial, and he highlighted that yoga care improved self-rated health and returned to pre-infarct activities earlier than the conventional cardiac rehabilitation. This was the editorial journal. This was the editorial which was published in JACC, which showed that exercise in the form of yoga and mental exercise, such as meditation and mindfulness, have benefits in primary and secondary prevention of cardiovascular health. This was another article which was published in Circulation, which showed that yoga boosts quality of life and emerges as an rehabilitation alternative. And it was mentioned that if we give more choices to the patient, especially traditional choices to the patient, it is more likely he will sustain and do it in the longer run. Because over a time, boredom sets in and the patient leaves it. That is the main problem during cardiac rehabilitation. So if we give them conventional and traditional choices, it is more likely that he will be able to sustain it. This was again a state-of-art review article which showed that yoga reduces stress, anxiety, and improves autonomic function. This abstract I have taken from Indian Heart Journal, where it has been shown that addition of yoga-based relaxation therapy to conventional treatment helps in better management of risk factors. Again, this article has shown that addition of yoga to rehabilitation improves subjective findings of cardiac health and quality of life. So we have n number of publications in last 1 decade which have highlighted the importance of yoga and meditation as cardiac rehabilitation alternative. This was a study which was done in India which showed that it reduces blood pressure, cholesterol, and anginal episodes. Dr. S.C. Manchanda is a pioneer in this field, and this was an editorial published in Indian Heart Journal where he showed that it is a significant tool for cardiac rehabilitation and leads to improved fitness, stress reduction, and patient well-being. This was again published by Dr. Harinder K. Bali, where he mentioned that yoga is an inexpensive method of addressing the core issue of epidemic of cardiovascular disease. This was a publication in European Cardiology Journal of Preventive Cardiology, where it has been shown that yoga can improve quality of life. So if you look at different articles of different part of the world, yoga has shown significant benefit in most of the patients of cardiac rehabilitation. This was a scientific statement which was given by AHA, and it has shown that studies of meditation suggest a possible benefit on cardiovascular risk management, and more studies are required in the similar direction. So in the end, if we do a SWOT analysis of yoga and meditation in cardiovascular rehabilitation, the strengths are, it is an indigenous method, it is a way of life, we Indians are born with it, and we have utilized it in some or the other way in our life. It has got a multidimensional benefit, be it body, mind, and spirit balance. We get a holistic improvement by doing yoga. It is cost effective. We don't need any devices or any equipment for that. There is no age bar. Even old patients can do pranayam and do some exercises which they can perform without doing those jerky movements and strenuous physical activity. The weakness is, as I mentioned, it is difficult to sustain interest in the long run, and it may not give immediate results, which may make the patient less likely to continue in the long run. And wrong postures, wrong methodology, wrong timing may cause some harm. And scientific evidence are upcoming, and we are very hopeful about more studies in future. The opportunities include, it is gaining popularity world over. Now 21st June is celebrated as International Day of Yoga. There are more ongoing researches, results are long lasting, and awareness can be spread to even small places and villages where gym facilities are not available. And it is revival of our own ancient knowledge, which brings a sense of pride to all Indians. It is one knowledge which has shifted from east to west. Most of the knowledge we are taking from west to east. So we should be proudful of it. And the threats include our unwillingness and inability to motivate people. There are certain religious dogmas associated with it, which we have to remove. And still we are laying more stress and investing more on treatment rather than prevention of the disease. So my talk is the first talk of the day by design or default, and yoga comes first, then comes all the things. Thanks for your patient listening.
What is your prescription for lifestyle modification like yoga, exercise, and meditation? What is your prescription like? How much time they should do for each?
Yeah, as far as yoga meditation is concerned, the prescription includes that we should at least start doing it. That's the number one point. Even if we do for 5 to 10 minutes, but at least we should start doing it. Because sooner we start doing it, the timing is going to increase in future, because the patient will become more confident of the results he's achieving. That's number one. And as it holds good for physical activity, same holds good for yoga and meditation. Minimum of 30 minutes to 45 minutes is something which is good enough if done in a day.
Completely agree with Dr. Mohan. It's like, something is better than nothing.
And which time is better, night time or morning time?
Morning time. Morning time is the best. Early morning, empty stomach, because there are many yogasanas which, if done with a full stomach, then it may lead to reflux, because there are many bending poses and all those things. And even Kapalbhati, if you are doing, then you cannot do it with full stomach. So the best is when you get up in the morning, free of all your basic schedules, and after that you do first yoga and pranayam, and then continue with what Dr. Shweta has said with the diet and other changes in the day-to-day life.
But meditation can be done anytime.
Meditation can be done anytime, even at night, because throughout the day you are stressed out. So if we do meditation at night and clear, it is like a recycle bin. So whatever junk is accumulated, if you clear before you sleep, then you wake up fresh and then you are ready for the next day. So yes, you're right, meditation at any point of the time, but yoga preferably in the morning time, preferably.
Thank you.
But can you do like alternate day or something, because both the things are doing daily, maybe time consuming. So is it possible to do that?
Yes, definitely. As I said, you have to set patient on the right track. that these are the changes which are going to do good in the long run. It is like depositing money in the bank. So if you do today, 2 days you don't do, but you do again, but at least you are doing rather than just wasting your money over buying things. So it is the same way. You have to start doing it. Suppose today you're doing yoga, preferably followed by meditation, because it is a sequence that your body is prepared and then you're calm down and then you're doing meditation. But there are days when you're busy and you're not able to do it. You can plan your regime that you're doing asanas today, tomorrow some short asanas followed by meditation, where you are focusing more on meditation, less on asanas. Yes, definitely it can be done as an alternate day or as a periodic schedule which you can plan. No issues with that.
I think Rahul and Rohit, the way in which they are complementing each other. Similarly, Shweta and Shilpi has done wonderfully well. And if there are no further questions, we'll go for the second bout.